I'm Dr. Camilo Hernandez. I'm a board-certified equine trigenologist. ICSI it's a reproductive technology that has been around for the last 25 years, but the last 10 years have gained a lot of acceptance in the equine breeding industry because of the many benefits that offer for breeders. We launched commercially the service in 2023. So this is going to be our third year as a commercial service for the large animal hospital. Person doing the ICSI needs to be knowledgeable. We're fortunate that we have a DVM PhD who does that, and that's her main job. She only does ICSI. The success rates we have here are comparable to what commercial laboratories have in the States and worldwide. The average production is almost 2 embryos per cycle in our hands. For our DVMs, I will suggest that it works great when we actually, most of the times they have the client and they say, well, my client wants to do ICSI, what should I do? If you don't mind, palpate the mare. Count how many follicles she's got, and then we can work out a schedule. The RDVM who doesn't know how to do it or doesn't have the equipment to do it, they can send it to us. But we also have a lot of RDVMs who know how to do the oocyte aspiration technique. The only thing that they need to do is send us the oocytes. We'll take care of all the fertilization in the lab, and we can either send them back the embryos, or we can send it to any other recipient facility they want us to send it, or we can keep it frozen in our tanks.
I'm Becky Legere. I'm an equine internist here at Texas A&M. I'm on the clinic floor, and also I'm pretty involved in research here. It kind of bridges the gap of clinical research and actually answering clinical problems, both for horses and for food animals. The biggest area that we're focused on is actually trying to understand how nebulizers and inhalers deliver drugs to the lungs and trying to figure out how to optimize that. A lot of the data and principles of nebulized drug delivery are based on humans who nebulize through the mouth, takes a 90-degree turn, goes down, but that's not what we have when a horse is breathing through the nose, or a pig or a goat or things like that. So we're actually designing and building a couple different types of respiratory simulators. We have 3D printed heads because there's an anatomical factor. Besides breathing in and out, then we actually have a couple different systems to measure the particle sizes. And so the particle size we know is correlated with where the drug goes into the lungs. We're doing this so that we can help referring vets and owners and the horses out there. One of the things that would be really helpful for us and our work is making sure that we understand how veterinarians are using nebulizers. What are the challenges that the veterinarians are actually facing, right? Out, driving the ambulatory truck, out on the track, out in all in these places. I would rather be actually answering the questions that folks are having. So really, reaching out, making those connections, and making sure that we are not only studying things in a realistic way, but also answering the questions that are really a problem. So I think the biggest thing right now is just trying to get a good grasp on how they're using them and what challenges they're facing and what questions they have. And that's what we can kind of start really moving forward and working towards answering.